Good afternoon, everyone. Today is Monday, the 15th of June, 2020, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So first of all, I'd like to start off with the global situation. The spokesperson mentioned this. I'll just recap it briefly that up until today, certain countries are still on the way up in terms of the COVID infections, including countries such as India and Brazil. For countries like the United States, the numbers show that they're a little bit on the way down. For Thailand and Australia, for example, the curve has been flattened for quite some time already. But still, of course, we remain vigilant because of the risk of new clusters, as we had reminded the audience for quite some time. New clusters have been springing up in some countries. I think we don't call it the second wave yet, but there is still that risk in countries such as China. In Beijing, there is a risk of new clusters that has been surfaced in markets, and in Japan, in Tokyo, in entertainment areas and districts such as Shinjuku. So, for the case of Thailand, for the past 2 days, the situation continued to be under control. Over the weekend, we did not have an English language summary, but for the numbers over the weekend, there were 6 new infections. All of them were imported cases from repatriation flights, and the people were directly placed into the state quarantine system. 5 of them were repatriated from Saudi Arabia, and another one from the United States of America. This was over the weekend. For today, it's the first day of the 4th phase of the relaxation measures. As you know, it's the 15th of June, the 4th phase now in Thailand. And many establishments and services will be reopened, around 95%. Now, I have a quick reminder, infographic on the relaxation measures as shown on screen, courtesy of the Public Relations Department. You can get details from that Facebook page and website. Also, as you would already know, there was no curfew. The curfew has been canceled since 11 p.m. last night, 2300 hours last night. And of course, today and in days ahead, there's no curfew anymore. The establishments to be open, you can see the details on screen. And one important piece of information that I'd like to highlight is for the foreign community, that apart from the scheme that we have already announced regarding the holders of work permit, they can register and file their documents with the Thai embassies around the world to return, and the return of work permit holders has already begun, as you know, on a case-by-case consideration basis. But aside from the holders of the work permit, the CCSA, as I've mentioned quite often, has been discussing to allow more foreign citizens to enter Thailand. And just this morning, we just had a meeting to discuss once again the criteria and the details for this scheme in order to, in due course, allow more foreigners to enter Thailand. And this will be the group of foreigners who have permanent residence and those who are married with a Thai spouse to be able to enter Thailand at the earliest opportunity. So there is progress in this. We are ironing out the details. So please stay tuned for more information and more updates on this issue. As mentioned just this morning was yet another meeting on this particular agenda. And the various agencies involved are coordinating their efforts and putting together the criteria and the process that would make this entry of this group of foreign nationals the most orderly, in the most orderly manner possible. So moving on to the issue of the general situation and the cases in Thailand, as usual. I mentioned earlier about the weekend numbers, but for today, Monday, we have 0, no confirmed cases. making the cumulative number of cases remaining at 3,135, as you can see on screen. Out of this number, 95.2% have recovered or been discharged. That's 2,987. High number have been discharged, and 0 fatalities. Very good to hear. Also, some observations. We are now on the 21st day of having 0 domestic infection. So that's quite good news. 21 days without any domestic infection. So 21 days, in the past 21 days, we have had cases, but all of them were from imported cases of those returning from abroad and placed directly into the state quarantine system, but 0 domestic infection. So that's very good to hear. And globally, Thailand is now ranked at number 88 globally in terms of number of confirmed cases and infection. Of course, number 1 would be the highest, and we're number 88 globally right now. So that's very good to hear. We hope to keep up the strength, the cooperation, the numbers. Hope that they won't be increasing. Hope that we won't find any new clusters. Hope that we will be able to contain all of the cases that we find, or the imported cases that return from abroad. Hope that will continue. And thank you very much for your cooperation. So the spokesperson also mentioned today about the use of Thai Chana, the Thai Chana platform. He focused on that, hoping that there will be more use of Thai Chana. There are actually many, 100,000 perhaps, of mobile users in Thailand. We're a very connected country. But out of those owners of mobile phones, we hope that they will be all using Thai Chana in a higher degree. Because in terms of check-in of Thai Chana, it's of course not equal to the number of people using mobile phones yet, of course. But we hope that will get higher. Because people using mobile phones, of course, they would be entering establishments, going to supermarkets, restaurants, and we hope that will be a norm and a routine for everybody who hold mobile phones in Thailand. On the issue of Thai nationals, repatriation, we give you an update around once a week on this. So we'll have to you on screen the scheduled repatriation flights, as well as the projection. To date, we have repatriated over 20,000 Thai nationals by air from 61 countries and territories around the world. Today, tomorrow, as you can see on screen, we also have flights coming in. And in terms of projection, from the 17th to the 22nd of June, we're expecting 23 more flights from various countries around the world. And the assistance to Thai nationals continue. As you can notice, we are doing this in parallel with allowing foreign nationals to enter Thailand in specific groups, starting with work permit holders, and as I mentioned, other groups in due course. So please be patient, please bear with us as we do this in parallel with the Thai nationals repatriation. So on screen, we have, as usual, images of our assistance to Thai nationals. Here with the Royal Thai Embassy in London, the United Kingdom, with Thai volunteer doctors providing one-stop service for Thai nationals that are repatriated. There was a flight the other day from London. These services include health checkup for the certificates, for the certificate of entry, and of course free of charge. And while providing these services, all officials of the embassy remain in social distancing measures when they meet with persons visiting the embassy. Also, another image that we have is that on the 13th of June, the Royal Thai Embassy in Rabat, Morocco, cooperated with the Thai community there to deliver care packages and medical supplies to 71 Thai nationals in Marrakesh for their daily use. The embassy is also planning to deliver these care packages to Thai nationals who remain abroad in cities in Morocco, such as Kenitra, Tangier, Tetuan, and Rabat. We also have good news stories every day, this time concerning vaccines. As you may have heard, Chulalongkorn University of Thailand is in the process of researching and developing the COVID-19 vaccine. The Chula Vaccine Research Center has been researching for the vaccine since February and conducted tests on mice, on animals, by the end of March. And in May, the test was conducted on monkeys. And as of now, we have some new progress. Chulalongkorn is preparing to conduct tests on human volunteers in October, which will take approximately 12 months from the test results, for the test results to be ready. And if it meets the expectations, the vaccine should be ready for public dissemination towards the end of 2021. Also in Chulalongkorn University, there is the CU Innovation Hub that started the startup called Baya that will be researching on this issue as well, and more information will be released from the university in due course. So there were some additional points, some Q&A that the spokesperson, that was addressed to the spokesperson himself directly. One was that why does the pubs and bars remain closed? I think this was received on social media. Of course, as the spokesperson reiterated and mentioned, some business establishments remain to be closed because the social distancing control of these establishments are a little bit more difficult to implement than other business establishments, and therefore there is a higher risk of infection. We're in the fourth phase now. Of course, the remaining, I would say maybe around 5% of business establishments still remain closed, including pubs, bars, as you know, karaoke bars, soapy massage. Of course, they will be open when the situation improves, because these are actually the business establishments with the highest risk, as I mentioned, because social distancing is more difficult to control in these areas. And as mentioned, there are, of course, examples of other countries that have these risks as well, and the new clusters have been found in establishments such as these. So it's a very good lesson to learn. That is related to the second question that the spokesperson received regarding the spread of COVID in new clusters in other countries, such as in markets in China and in entertainment venues in Japan. So when on social media we were asked about why pubs and bars are closed in Thailand, a case in point I'll mention is in Japan, as mentioned about the new cluster, particularly in the entertainment district of Shinjuku. There was information that the new cluster of infection was spread from the entertainment venues, what they call the host clubs in Shinjuku in Tokyo. At the same time, in China, the markets, it was found that there were COVID infections on the chopping table where raw fish is chopped up. Of course, we have to be careful now on eating raw fish. Cooked food, of course, is the best. But on the chopping table in the markets in China, that's was where the new clusters were found. So markets and entertainment venues still are risks in other countries. In Thailand, that's exactly the reason why the pubs and bars, if you compare it to Japan, we're still closed on that, just to be in the most 100% more precaution, to practice the most precaution possible. And the Department of Health of the Ministry of Public Health invites the general public to inform them of any leading information about the violations of compliance, if there are any bars and pubs that are open or any markets that practice unhygienic practices on the chopping table, on the various stalls, and the kind of food or products that they sell in the markets. If it is unhygienic, you can report that to the officials at the Ministry of Public Health. So just in terms of conclusion for today, of course, it's the first day of the curfew lifting that we have, actually since last night, but since now we're going through the fourth phase of relaxation. Of course, there needs to be the serious adjustment of our daily lives to continue with the routine for the new normal environment. The guard remains high even though we are traveling. Some people have traveled to nearby provinces, to beaches, and enjoyed restaurants and shopping malls. That's fine, of course. That's very good. We have to relax, of course, after the past months have kept us home. But of course, when you go out, please continue to keep your guard up and remember to practice the new normal lifestyle, as you see on screen. And the spokesperson mentioned quite often 6 measures to prevent COVID. Before it was 5, now it's 6, because the 6 is using the Thai platform. And we're congratulated on the good news about today's 0 infections, and the, of course, progress of the vaccine, but not to forget that everything would take time until the vaccine is ready. So in the meanwhile, we practice the measures that we have announced. That's the best thing that we can do right now. So the last slide that I have on screen, not including the caricature that you see on screen right now, is the 5 measures. So what is wrong with this caricature, with this slide? It's only 5, right? So actually, it has to be 6 now. So 5 plus 1 measure. So the one last measure, these 5, washing hands, and the rest you see on screen, plus 1 measure, that is using the Thai platform. So thank you very much for your attention, and for the English language summary, I'll see you again on Wednesday. Please stay safe and take care of each other. Have a pleasant afternoon, and have a good, pleasant and happy Monday as well. Thank you very much. สวัสดีครับ